Okay, so for tonight, we're going to help walk you through the 5 steps to relieving your hip pain and keeping it away for good. My name is Dr. Chad Coons. I'll be your host tonight. We want to help make sure that you not only find relief, all right, with what we have to say tonight, but some of you may be wanting to avoid that really unwanted hip surgery, and we want you to truly just get back to living life again. Get back to just enjoying it, not just kind of suffering and getting through and surviving. I know how that is. A quick backstory is I had hip surgery at a very young age. So if there's one joint in the body that I know extremely well personally, it's this one. But I want to kind of bring to you my professional opinion on what you can do right now to take action. So what are we going to learn tonight? Well, first off, we need to understand what's actually causing your hip pain. Is it bursitis? Is it arthritis? Have you been diagnosed with impingement? So the 5 sequences and steps that you're going to learn tonight in order will be how to properly get rid of the inflammation, because almost every time we have some form of inflammation in the hip when you're in hip pain, we want to teach you what restoring your hip alignment truly means and what you can do right now to do that. We want to also teach you how to fire your hip's rotator cuff. And that might ring a bell. You might have heard of the rotator cuff for the shoulder. And it's a little bit of a play on words because there's not really a rotator cuff for the hip, but there are muscles that act like it, and they're almost just as important to fire to help stabilize your hip, to help you feel pain-free. So we want to walk you through what you can do to fire those muscles right now at home. We also want to just kind of pick your brain and bring about some awareness. You know, how you move matters. You may not even have thought about this. Your chiropractor, physical therapist, or massage therapist may not have brought some of these movements and postures to your daily attention. So we want to really kind of dig deep into that. And we also want to make sure that we prevent hip pain from coming back, and also to avoid any unwanted surgeries. Really, our goal is to help prevent surgery forever. And some of that may be sounding too good to be true, but I can tell you, if you follow these 5 steps that we're about to go through, and this is what we do in our sports clinic all the time, it really is possible. So what's causing your hip pain? You can just type this in the chat. Is it arthritis? Have you been diagnosed with piriformis syndrome? Bursitis? And I put the physician there because we notice a lot of physicians are diagnosing hip pain as bursitis, even when we may differentiate. We may not believe that's the case, but the physicians are often diagnosing as bursitis. And some of you may have heard or have tight hip flexors, so we'll want to investigate that. Okay, so here's a quick review of some things that might be causing it. I wanted to give a 3D look on our anatomy model here. So it could be arthritis, could be a labral tear. If I could actually pause it right there. A lot of you have been diagnosed with hip bursitis. So trochanteric bursitis is the most common one on my anatomy model here. It'd be right on the outside. Some of you have trouble sleeping at night. You don't like pressure on that. So trochanteric bursitis is probably one of the more common bursas. But understand there's a bursa just a little bit superior, not as common, but a gluteus medius bursa could cause your pain. Some of you have pain on the inside of your hip, right in the hip crease. So this would be kind of the front. So some of you might have it right in the inside of the crease of the hip. And I'm sure you wouldn't have been diagnosed with this. They may not know why. You may have been diagnosed with arthritis. But we actually tend to find sometimes it's an iliopectineal bursitis, which you may not have heard of, but it's in that location right there in the front. Obviously, the piriformis syndrome would be in the back, but on the front side, we also have the psoas major and minor. Those are common hip flexors that do get tight, that actually can cause poor alignment in the hip, and so we find ourselves releasing those muscles in addition to this rectus femoris. That muscle, if I could go back a second, that hip flexor actually has attachments, has a reflected head that actually attaches to the labrum. So some of you have been diagnosed with a labral tear, but I've noticed that releasing that rectus femoris can actually take away some of the pain from the labrum because it has an attachment point to it. And then some of you, you may not know it, but you actually have a femoral neuritis, or you have inflammation in the nerve. You might find that it's incredibly sensitive to even put on a pair of pants. You don't like any compression. And a lot of times that's the nerve kind of going, hey, you know what? You need to get out of here. I need more space. And that's often that nerve, which could be due to tight hip flexors. Who knows this picture? What a great movie, right? You want the truth? Can you handle the truth? Well, here's the reality. I'm going to be honest. A lot of these conditions or diagnoses are overdiagnosed, and we tend to find that this isn't the root cause of your pain. It's depending upon how you're moving clinically, the muscles and the strength and the range of motion around it. But arthritis, this is kind of anecdotal numbers, so don't worry about that, but just kind of a general scheme I want you to know about and kind of give you hope. It may or may not be truly hip arthritis that's causing your pain, as is the case for bursitis or piriformis syndrome. We tend to find the root cause of the pain actually has to do with your hip's poor alignment. So if you stick around long enough, we'll actually walk through that in step number 2. How to properly get rid of the inflammation. As we said, a lot of times there's inflammation hanging around this joint. We need to loosen that up. We need to get the inflammation out of there. So what does it take? Well, I want you guys to know, because some of you are sitting with an ice pack or bath or what have you on that hip all night. You'll sleep with it and you just live on it. Well, I want you to know that actually may be counterproductive. Icing more than 15 minutes can actually yield what's called a hunting response. And you can see on that picture right there, you're going to get a lot more vasodilation. It's a response, a cardiovascular response. And this means that you're going to get the opposite effect of what you want. But I suggest only going 15, maybe 20 minutes at the most. And then also, you guys need to know where to ice. That's actually really important. Now on this anatomy model here, I want to show you the 2 most accessible areas where you can ice. So it's going to be where we have the least resistance in terms of the muscles getting in the way. So as you can see, I'm going to play that one more time for you. There's not too many muscles as we go deeper from superficial to deep. There's the IT band and a hip flexor, but look, we're already right to the joint. For those of you that truly do have inflammation in the joint, and that arrow over here on the right side is pointing to that trochanteric bursa, that means we can efficaciously get right to the bursa, all right? Because it takes time and it takes kind of the right area for ice to seep down deep enough to get into those areas. So it would be kind of in the front outer crease, if you want to think about it as that. That's where you have the least amount of muscles influencing that, and specifically on the outermost lateral side is that trochanteric bursa. That's always a great place to ice because you can get right to that bursa. Now we also get asked about heat, so I did want to include that. So the best places are more thicker muscular areas. So as we take a look at this picture, the back outer glute is a great area to heat because it's all muscle there. We want to help loosen that up. And then I would say kind of the inner medial side, this picture up here, is another really great place to heat. It also gets into the inner thigh or the adductors, and that can be incredibly helpful too. So a lot of the meat and potatoes in terms of why you have hip pain is coming up right here in terms of our alignment. So let's take a look at this. Restoring our hip alignment. So that picture right there is showing you in the red, which is that you don't want, that's kind of where the femur is sitting. It's like it's sitting out of place. And you can see that it's not sitting right in the acetabulum. The green is indicative of the right spot. That yellow arrow is the movement that we want to take place. We want that femur to move kind of from that superior medial or inside. We want to kind of slide it right back in the middle, kind of analogous to this golf ball on the golf tee idea. And you'll hear me say that a lot with both regards to the shoulder and the femur and the hip. You want that to sit right in the middle. That's one of the main goals that we have. So this is what the error is, or some of the problem is for a lot of you due to maybe tight hip flexors, the way you're sitting, the way you're standing. The blue might be your natural starting point. And although no trauma happened, no car accident happened or anything like that, all of a sudden you develop hip pain and you go, what is causing that and why? But you can see here per step 3, over time, there's kind of a gradual shift. You might even see that shift happen. Like let's say if you were underneath an MRI and you were squatting down or bending down to pick something up and you did it incorrectly, you might literally see that shift of the femur move into the wrong location. So, actually, let me just take a step back. What doesn't work? So a lot of you have tried physical therapy. Some of you have tried chiropractors, maybe even massage therapists tried this. So I'm going to give you a little comedic relief here. But you would go there and just stand there and this person pulls on you. You don't really feel anything. And eventually you go, hey, come on, what are you doing? I don't feel anything happening like that. That's Anthony. He's our office manager. So the funny part there is you're not doing a whole lot to the actual hip joint. You might get transient relief. And these are a few other reasons why you don't get that long-lasting relief. That alone, that technique is not going to maintain itself. You might feel the discomfort get back into the hip as soon as you get into the car or even on the way home. So as soon as you start walking, because all you're doing is pulling it down. In that technique, all you're doing is pulling it down. So what happens as soon as you start walking again? It gets jammed right back up. It doesn't address the tight musculoskeletal areas or the tight spots in the hip that actually need to be addressed. And it doesn't correlate to improved range of motion. You just have the same range of motion. So it's very transient. It's not the worst case scenario. You can get some blood flow in there, but it's not going to yield us long-lasting release responses and techniques. So this is actually some of our favorite techniques. There's a couple of them that I really want you to know about. So the first one is I'm pulling lateral. I'm pulling the hip lateral. We're getting traction in the hip. I'll show you a great picture of exactly what we're doing. But I'm creating space. I'm improving more internal rotation. That is kind of a picture as if you were with the belt. And I'm pulling and I'm opening up that joint. And that is the spot right there that we're trying to get the most motion. So here's what's actually happening. So I zoom way in and you can see kind of that gapping technique to the femur. We're getting blood flow in there, loosening up the capsule. As I pause it there for a second, the capsule is, if you can imagine, this is a good analogy and a visual for me. Imagine a baseball, imagine an aluminum foil tightly secured over it. That aluminum foil would be representative of the capsule. Certain parts of the aluminum foil get really tight, and then that baseball can't really move fluidly in and around that. When we get specific techniques like this, you'll see me using a Mulligan belt. It's just another technique for me to get a stronger lever. I can truly get my hands close to that femoral head and truly gap that. This is an inferior glide, okay, where I'm pulling down, and that's another technique. Depending on your hip and your anatomy, you may need one or the other technique. This would be kind of me showing you the belt. I'm wrapping it around the head of that femur, pulling down, and again, we're getting traction on that. By the way, Anthony and I were both COVID tested negative before we did this, just so you know, with the mask. Okay, so what can you do at home? I'm going to be honest, this is the best attempt that you can do at home. It does require a little bit of a nuanced positioning and circumstance. So you use the heavy duty bands. It's going to wrap around the front of the femur there, and you're going to rock back and forth, okay, in quadruped. So that band, as you could see, is kind of similar to what I was doing with the belt. We're pulling it laterally. You're trying to get a gap. The problem with this that you might find is that you can't really just relax the muscles because you're in quadruped or this hands and knees position. So your muscles and your stabilizers are automatically going to guard it. I'm just going to show you right now, if you go to YouTube and you try to find techniques like this on your own, that's probably going to be your best bet. You will need heavy duty bands and you'll need to attach it to something that's very stable. I tend to find those techniques that I showed you where you're relaxed and I get a good grip and I can push you. Sometimes we just need a little help. Sometimes you just need a catalyst to get things going, and then you're able to start stretching and doing things more on your own. So what can you do right now to get these deep six muscles firing? Again, this is kind of an analogy to the rotator cuff. This is really a common part of our program that we get almost everyone doing, and you can kind of emulate and mimic this at home right now. I'll just restart that for a second because I was chatting through it. I want to get you on your side, okay? So if your problem hip is your left hip, you'd be on your right side. You can kind of see Anthony doing that. But I want you to kind of really watch carefully how I help get that hip up and back. Because what you want to know, what you want to find at that very top position is that your heel is back behind your trunk. You're moving your hip into extension. And it's unbelievably important to learn how to drive that back and rotate. That green line is where we want to be behind, because typically in my clinic I find it's very hard for people to do this. In fact, what I'll show you here in a second is what people do incorrectly. That's usually what people show me even after several rounds of physical therapy or working with a chiropractor or a massage therapist told them to do this. They think they're firing the hip and they think these hip exercises aren't working for them, but indeed they're actually just doing it incorrectly. You can see there his hip was in front, and he's actually probably using the muscles in the front of the hip like the IT band. So you're totally missing out on what you need to be doing with that exercise. So if you want to try this at home, not that you have a laser in this whole setup, but I want to just give you a visual of what you're thinking about doing. And this is a technique we'll actually do in the clinic to help you give that visualization, to help you do it even better at home. My clients are telling me, I see that laser as if it's there right now, just because we'll practice with that. But he's holding on to a laser on the front right side of the hip, and you can see that kind of vaguely on our wall. So I'm going to show you where it's pointing to. Now, as he does this exercise, I don't want to see that laser go up. There's a good line showing you what, and that's kind of just a visual I gave him. Don't let that laser go above that line as you're doing this, because if you do, that will be indicative of the whole hip rolling back and you using the wrong muscles. The hip flexors and the IT band and even some of the quads want to compensate. So I just wanted to give you that quick idea of how far we're actually willing to go to make sure that you fire those right muscles, because it's so common to not fire those well. It can take weeks to really learn how to do that. All right, so as we're kind of getting closer to the end, I want you to pay attention to some everyday movements. I want you to start to think about how you're squatting, how you're lunging. Are you doing the stairs correctly? Are you sitting well? A lot of people are working at home now. Do you have good ergonomics? Do you have a proper positioning? And let me tell you right now, it's not about sitting up tall. As you can kind of see, I'm relaxed back, and that would be a position that I actually want you to be in. I don't think it's good to sit on one of those big medicine or Swiss balls all the time. I don't think it's great to sit up straight all the time. You actually need to be reclined back a little bit. And it might be surprising to you. Walking, what are you talking about? Well, has anyone ever really taught you how to walk? Probably not. You probably just learned to do it and whatever feels most natural. And that can actually cause significant problems. So what if you come in and you squat really well and you lunge really well? And let's say you even do the stairs well. After we record you in slow motion, we analyze that. But what if you don't sit well? What if you don't walk well? How often are you doing those things on a day-to-day basis? Every day, right? You can't get around a lot of these things. Squatting, go to the bathroom, sit down in a restaurant chair, you're squatting. You drop something, you want to lunge down and go get it, which I suggest, because if not, you're probably overusing your back and your hamstrings. You need to be able to lunge down to get that, go into that half kneeling position. And I guarantee you sit and walk every day. So if we don't take care of those things on a day-to-day basis, you can go see whoever you want as long as you want, but the chances are the problem will keep coming back. Even if 2 of the 5 aren't done well, that's enough of a perpetuating factor in movement and positions that'll keep your pain coming back. What if you don't squat well, lunge well? What if you go up the stairs with a weak hip, and your muscles don't fire well, and you're giving too much of the burden to the bursa or the hip joint itself, and that causes inflammation? And then you sit at work, you drive home, you don't sit in the right position, and then you can start to walk for a little bit, but then your pain starts to hurt. Well, this is what we find. We tend to find that the whole slate kind of needs to be redone. You need to deconstruct your movement patterns and completely relearn it. And this is where it's much more of a mental game than it is actually learning how to do exercises per se. Exercises will help reinforce the daily movements and practices and positions and postures. But it's not just about doing exercises. And I think that's where healthcare in itself goes wrong. Now, let's say you've done all that well, you've mastered that, you've got those muscles firing, the hips in a better alignment. How do we keep it from coming back? How do I know it's not going to just come back just like anywhere else? Strengthening what has worked. And then that's just kind of a visualization I want to give you, that margin of error there in the orange box. The stronger you get, the more of a discrepancy and differential and room for error. So if you go travel, you sleep on the wrong bed, you walk and you take a look at all the castles in Germany, you walk and you do whatever you want. But maybe that's not normal for you, and it's a lot for your hip. But you've conditioned yourself to be able to handle it because you have the inert strength. You've got the manpower there, if you will. In fact, what we do, we give people an Excel sheet. We have a private cloud-based server system so that we can record you in the clinic with a video. There's that yellow link you can see. You could click on that when you're traveling or wherever it may be, because it's so important for us to help you learn how to do the movement well, ingrain it so you can embed that on a day-to-day basis. And here's really the 4 keys, I might say, for a pain-free life forever. And yes, it is possible. We do it over here all the time with a very high success rate. Because you know what? It's not easy. It takes time. If you're willing to put in the work, which you'll see in our Google reviews a lot, and they say, and it's so true, you have to be willing to put in the work over time. You basically have to form a habitual lifestyle of building in some form of a workout program, which might even be just once to twice a week for 30 to 45 minutes. You don't have to be working out 6 days a week or anything like that. It's amazing how just a little bit of that consistency will go such a long ways. But without further ado, these are really the 4 key areas that need to happen for you to feel good forever and avoid that hip surgery and have that pain-free life that you want. Get the strength, continue to build on that, maintain good mobility. So if you sit every day at work, it will take effort on your end to keep that hip mobility. Your body will just respond to the adaptation you give it otherwise, where you just sit and sit and sit. It'll go, oh, okay, I'll just sit and tighten up and get used to that. So you have to give it a justification to keep that mobility. Tissue quality, I haven't mentioned much about that, but if the tissue quality is hard, it's sensitive, it hurts. Some of you tried foam rolling, it's just so sensitive. Well, we need to start somewhere, and that tissue quality needs to feel better. We need to get in there, make sure the glutes and all those muscles have a better chance to fire. And then you need to be consistent on your part, where you're doing the exercises, like I said, even just twice a week. We can discuss exactly what that program would be for you. Whew. All right, we talked about a lot, and you're thinking, you know what, this model is a little unique. I like it. I'm kind of interested in working with these guys. Well, we're absolutely here for you. We don't want you to rely on just resting, avoiding what you want to do, pain pills, or just icing day in, day out just to kind of get by. Furthermore, I don't want you to have to get the massage every week or every month just to kind of get through life. And I certainly don't want you to have any more corticosteroids, expensive surgery, especially if you have to take time away from work and you're not even sure if that's guaranteed to work. So what we're offering you, for those of you that are with us right now, whether you catch us live or we will put out a replay, so if you watch us on replay, that'll be there too. And if you're catching us on the replay, this offer is good for you as well. Instead of our typical $249 assessment, it's just going to be yours for $49. So you can click on the offer right now to go ahead and get started and check that out. And I want to kind of walk you through briefly what you'll get with that. It's so important for us to understand your story. What have you tried? What have you not tried? What's working? What's not working? We're not here to recreate the wheel. Let's move into it right away. In fact, you're going to see we're going to want to hop on a call with you before you get in, because we want to know what's worked and what hasn't, so we can accelerate relief and jumpstart that plan on day one. Our goal and my mission for you on that first pain assessment is that you feel relief. You feel some sort of a difference that you haven't felt before. So it's a big order, but that's what we're looking for. It's a full hour. We will go through a postural examination, looking at your knees, your feet. We can talk about orthotics, your low back position. We can start to assess how you're moving, whether you're squatting or lunging. We'll absolutely take a look at the strength. We have a dynamometer in the clinic, so I can literally see how strong you are objectively, how many pounds of force you can give me. And some of you are thinking, oh God. But it's good. I mean, you can see the before and you can see the after, and we can see objective improvement. And that's really important for me to see and to substantiate progress. We can assess your joints in the clinic. We can provide you a diagnosis. We can educate you. We can start to give you stretching and strengthening programs, and we can get a lot done, if you haven't noticed here, in an hour. We can also tell you, it's very important, a lot of our clients are asking for, what can I do, what can I do, what shouldn't I do? We can answer those questions before you leave on that first assessment. So this is typically what you might find that we'll provide you. It may not be done, by the way, after the first assessment. I like to see, after I've done some sort of hands-on work on that first assessment, I want to see how you responded, because that can be a big difference from someone who was really, really sore, maybe more painful, versus someone who came back a couple of days after I did the hands work and they go, man, I feel a lot better. That's going to give us a different idea in terms of what your prognosis will be, but it's really important to me that you have a clear understanding of the expectations and how long is this going to take, what's required on your part, how much energy, how much time is going to be needed. So we want to kind of plan that out as best as we can. So thank you so much for being here. Again, I encourage you to check out the offer. If you're on the fence, if nothing else, just schedule a call. Just call and we'll spend 10, 15 minutes, as long as it takes, to answer all your questions. If you have any questions on insurance costs, we're happy to explain to you on the phone what that looks like. But what's most important to us is that you get results. And hopefully this hip webcast tonight gave you a little bit of an idea of how we'd like to approach your hip and how we can really get strong results. So thank you so much, and we look forward to seeing you soon.